Hello, my name is Priyanka Prakash and I'm from Let's Update Language Academy, and this is
Maria Sachi from Let's Update Language Academy.
okay. And as you all know, we are here with the latest role play card. As we always come, again, we are here with the latest role play card. The examination January 22, the exam conducted on January 22 exam role play card is here with me. So we'll be presenting that. Before that, we'll give them a brief introduction. I definitely feel that this will be really helpful for all the exam takers. Okay, so I'll give you a brief introduction regarding the role play card first. Then we'll move into the presentation. Okay, Maria? Okay, so the setting is hospital ward. Hospital ward itself indicates that this is a non-case. And the patient is 60-year-old and is scheduled to have a heart surgery in a few weeks. And you have just completed the preoperative assessment, which was satisfactory. This is the information given in the scenario. And from this point, we are starting the presentation. So Maria will be playing the role of the nurse and I'll be the patient. So shall we start?
Yes.
Usually we have 3 minutes as the preparation time. Right now we are right away starting to the presentation. So we'll watch the presentation.
Okay. So thank you so much, Ms. Priyanka, for your kind cooperation for the preoperative assessment.
Okay.
All right. So while doing this preoperative assessment, it's all everything is satisfactory and nothing to be more concerned about your preoperative assessment because everything is looks like fine.
All right.
So I would like to ask you that how are you feeling to stay in the hospital?
Well, I'm feeling very fine in the hospital, but I'm quite worried about the intensive care unit. My doctor has told me that I'll have to stay a few days in intensive care unit. So I'm worried that will I be really unwell after the surgery?
All right, Ms. Priyanka, I know that you're really anxious regarding that intensive care unit once the doctor has told to you, right?
Yes.
All right. So what I have to say that is nothing to be worried much, Ms. Priyanka, because you know that you are going for a heart surgery within a few weeks.
Yes.
So it's a routine procedure that once the heart surgery has over, you have to be observed in intensive care unit to reduce or to avoid further complications.
Okay.
So that's the main reason we are making you to be in this intensive care unit after your surgery. Is it clear?
Yeah, that was pretty clear to me. So now I understood why I'm in intensive care unit. But could you please tell me how long I have to stay in the intensive care unit?
I'm so sorry to tell you, Ms. Priyanka, because I'm not the right person to say you that how long you will be there in the intensive care unit, because the intensive care unit, the doctors will be there. So he has to see you and you need a speedy recovery. So once everything is fine, only the doctor will be shifting you to from the intensive care unit to the ward. So it can be decided from a medical team.
Okay.
So you have to wait for that, Ms. Priyanka. But I will make sure you that you will feel very relaxed and you won't be have any tension in the intensive care unit because there are so many nurses and you will be having a particular nurse to monitor you for each and everything. Is it clear?
Yeah, that's so relieving actually for me. So I am sure that my parents will be allowed inside. Am I right?
Definitely, Ms. Priyanka, visitors are allowed, but there are some protocols we have to obey in the intensive care unit because there are so many patients are there with high risk and all. So if we are allowing most of your relatives or more people, there's a chance of getting infection for others. So to reduce this infection, it is necessary that we have to follow the rules, especially visiting time, because we have only a visiting time for 15 to 20 minutes. That only one family member.
Okay.
That is okay. That's clear.
Yeah, that's clear actually.
Oh, all right, Ms. Springer. So I'm happy that you are adjusting with that.
Yes.
All right. So I would like to say you some more points that I would like to ask you some questions more over that. Because once you are in the hospital, especially in the intensive care unit, so how you are feeling or how you are planning to spend the time in the intensive care unit?
Well, that's a nice question. Actually, I have planned to read a book, which is I'm halfway, and also I'm planning to listen to music. I assume that that's okay in intensive care unit.
Yeah, that's very good.
Yeah, am I right? Like, is it okay?
Yes. Yes, Miss Priyanka, that you can use headphones and for listening to music, because
Yes.
in the hospital, especially in the intensive care unit, there are full of machines, staff, and visitors, and there are some more patients. So you will be distracted with these sounds and all. So if you use headphones, it will be very good.
Okay, that's a good suggestion from your side. Definitely, I'll take a
All right.
headphone.
Okay.
So thank you. That was a good explanation.
Okay, Miss Priyanka. So I hope that I has cleared all the doubts. So would you like to ask me any more questions regarding this?
Well, no, it was pretty clear to me.
Okay, I'm so happy that you have cleared everything. So I hope that of a speedy recovery and you will be having a relaxed the hospital stay.
Definitely, I hope so. Thank you so
Okay,
much.
thank you so much, Miss Priyanka.
Okay, so thank you. I think I have transformed into a patient, and that was a wonderful nurse by my side. She was so relieving and relaxing. So, this is what is expected from our students also when you present for the examination. Your sound should be confident. I always insist, or I always advise that it is very important the sound or the power of your voice should be above your patient or the interlocutor, because you are the one who has to provide confidence to the patient, and your sound should be prominent there. And I could see that confidence in you. It was a very wonderful presentation, and she was very particular about making me relax all the time by asking certain questions and apologizing at the point which was required. So I'll start from the introduction. In the introduction, if we can check, we will find it out that the you have just completed the preoperative assessment. So it was you have just, a little time before completed the preoperative assessment. So we are actually continuing the procedure. So here there is no need of an introduction from your side. She right away called my name and started with a conversation. So that was an appropriate thing to do. And she said that this is beyond my scope. I'm not the right person to give you how long you'll have to stay in the hospital. So the key word which is written in this card is resist request to give specific time scale for intensive care unit. As I always mention to my students, when you see this resist, that means you're unable to give answer. So always make sure that when you get this keyword, this would be the appropriate answer you can give. I hope this was helpful for you. Definitely, there are a lot of points to be taken care of, and we'll be coming with the latest role play cards every week. So, thank you. This is Priyanka Brother signing out.
And this is Maria Sachin.
Bye.
Bye.